Greetings, Tony Mobley here, and we're back with a new episode of Conversations with Tony Mobley. And I'm happy to share with you tonight that we're going to have a very serious conversation tonight about mental health. So I hope that you can glean something that will be helpful and informative for you and your loved ones. This is, as I said, a very serious topic, and we hope that you do get something meaningful out of it. So why are we here? We are here because life has provided me an opportunity to have real conversations with real people. So that's what we try to do. Tonight, we're talking about mental health. We hope to help others with these conversations. But I do need your help. How do we get started with making a difference? One of the ways in which we get started with making a difference is to ask questions. So I'm going to ask you to ask questions in the Mukana chat. I'm going to ask you, and the way that you ask questions in the Mukana chat is to actually come into the webinar. And if you go to the website, Conversation with Tony Mobley, and you register, you can come into the Zoom webinar and you can participate in the Mukana Conversation with Tony Mobley, Mukana website, Zoom webinar, and you can ask questions there. You can also ask questions in the YouTube chat. So if you like this conversation that we're going to have tonight and the past conversations, I'm asking you to like and subscribe. So set the bell to all the notifications so you can be reminded of these great conversations that we're having. And so with that, we're going to start with our conversation for tonight. Our conversation, again, is on mental health. And I have two very special guests, two therapists, Carla Hawkins and Ernest Benson. And they're going to share with us tonight. And they're going to also provide some resources for you to link up with if you have information that you need to share or glean from this conversation. So again, I want to thank you so much. Again, our special guests, our therapists tonight are Carla Hawkins and Mr. Ernest Benson. And so we will actually hear from them right now. So first, we're going to go to Carla. Good evening, Carla. We're happy to have you.
Hi, Tony. How are you doing?
I'm doing well.
Great. Thank you for having me. First, I'd just like to say, Tony and I go way back. If I go back, say how far back we go, then we say how old we are. But we go back big brother, sisters days. And Tony, I can understand your passion for mental health because you've been in mental health, matter of fact. So I'm just thrilled to be here with you today. I'm Carla Hawkins. I am a licensed professional counselor here in the Metro Atlanta area. I have been practicing since 2001. I have a private practice, practical guidance and psychotherapy. I've been in practice with that practice for since 2005. I also dual as a behavioral specialist for the City of Atlanta Psychological Services and EAP. And I have about 20 years of experience in the mental health field.
Thank you, Carla, so much. And Mr. Ernest Benson.
Hello, Tony. And again, thank you for having me as well. My name is Ernest Benson. I am a licensed professional counselor, and I also am in the Atlanta area. I am in Hardin County, Douglas County, Fulton, DeKalb. I have been actually practicing the last 3 years, but I've been in mental health in terms of working in hospitals, working in group homes, and going into homes, doing family dynamics as a community support specialist prior to becoming a licensed professional counselor. So I've been at this work for quite a while. And so I just decided to go to get licensed to move further in my career and my helping profession.
Fantastic. Thank you, Mr. Benson. Thank you, Carla. And so before we go to our questions for tonight, I'm going to ask our two other guests who are participating on the panel tonight, Dr. Clark and Mr. Rupert McRae. I'm going to ask you guys to share why you're here tonight and participating in this conversation. So we'll start with Mr. Rupert McRae.
Thanks, Tony. I'm Rupert McRae from Dallas, Texas. I know Tony through the office hours community, and I actually have a engineering background, and now I live in the corporate world. But I have an inherent interest in mental health and wellness and things like that. So it's just an opportunity that I wanted to come in and collaborate and contribute to the team. So I'm just pleased to be here and meeting our guests and looking forward to the conversation.
Thank you, Rupert. Dr. Clark.
Good evening from Tempe, Arizona. I'm Chris Clark. Yes, it is a good evening. And like Rupert, I've met Tony through Office Hours, which is a morning show, so to speak, that's mostly more technically oriented, but each Saturday morning there's an education hour that's often goes for 2 hours, talking about matters dear to many of our hearts. And of course, the field of education, where I've spent most of my career as an educational psychologist and researcher on teaching, is rich with mental health issues. So that, in a way, that's probably why I was chosen or encouraged to be a member of the panel tonight. I facetiously thought that perhaps Tony had tricked me into coming as a case study in which some of the mental health issues that Tony may have noticed in my behavior over the last 6 months can now be fixed. It could be a kind of, what do they call it? An intervention. But I don't think Tony would pull that on me. So I'm here to be as helpful as I can, and I'm honored to be among this august company.
Thank you, Dr. Clark. Thank you, Rupert. Dr. Clark, I ask him to come every week, so it's not a big secret. Everybody knows that I asked Dr. Clark to participate, and if he's crazy like a fox. So I just wanted to share that. So we're going to start with a couple of questions of my own, and then we will go to some of the questions that the audience and the attendees have. So my first question is, can you please define the term mental health and maybe even the kinds of mental health issues there are? And so we're going to go to Carla first.
All right, Tony. Well, when we hear the terms of mental health, we are thinking in terms of our emotional and psychological well-being. And then when we talk about how, in terms of it being your psychological effects, as well as how you are emotionally. And so when we look at that, then we look at what mental illness is. And then when you spoke of saying maybe different type mental illnesses and what would be along those lines. So if we look at and say mental health, that's our well-being, how well we are emotionally, how we're functioning, how we're feeling about ourselves. When we think of that, people think mainly of sadness. We think of depression, we think of anxiety. And so those things fall into how is our mental health. And so then I think you asked the question in terms of what is mental, in terms of diagnosing, let's say diagnosis is kind of what you were talking about there when you said illnesses. And so that means that we're looking along the lines of the depression, bipolar, those diagnoses would fall under a mental illness. And so I think when we want to talk about mental our mental health, we want to think about it as just as our physical health, just like you want to be well as, you know, physically and free of diabetes and high blood pressure and all of those diagnoses, you want to be emotionally well. So when we're speaking of our mental health, we're talking about being emotionally well. And I think in our country and today, mental health, sometimes when we hear that, there's a stigma that comes along with that. And so with that stigma, it kind of goes back to some of the things of, oh, there's something wrong with me if I'm not mentally well, or if I'm having emotional issues or mental issues that come along with that. But 1 out of 5 American experiences some kind of diagnosable mental illness or emotional disorder. And so when you look at that, that's roughly about 40%, 46% of the population that deals with some kind of emotional mental health issue. And so when we, as I said, that can range from, sometimes we talk about adjustment disorders where we're experiencing anxiety or stress or acute stress, PTSD. All of these diagnoses come along with mental illnesses or mental health issues.
Okay. Thank you so much for that. Ernest, would you like to add to that?
Yeah, I totally agree with Dr. Carla. But I just want to kind of emphasize, like, our mental health is just our capacity to manage life, work, balance, family, the stresses of life. Because we're all going to have trauma, we're all going to go through stress. But being mentally healthy and being equipped to handle those situations is what allows you to have positive mental health. But as we all know, sometimes things become overwhelming and the stress takes over. It could be from trauma. It could be from death of a loved one, breaking up a relationship, losing jobs. So when those things happen, sometimes there's a pileup of things that happen. So you have a complex trauma, a traumatic situation. You have multiple situations that can become overbearing and overwhelming. That's when your mental health could be compromised, and that will lead over to a mental illness. And it's oftentimes just that simple. Sometimes, like, it can go from just being regular sadness to being expanded sadness, extensive sadness, sadness to the point where it becomes depression. If it lasts for over 6 months, then it may be persistent depression. So then you may have to seek more professional help. You may end up going to the hospital, going to ER. So then that's when you have a situation where your mental health leads to mental illness, and then it becomes something more serious. And at that time, you may need to be hospitalized. You need to seek help at a different level. So I just want to kind of add that because, we all have positive mental health, but there's also negative mental health. And how does it go from positive to negative? That's where we have to draw the line. That's where we have to be cognizant of our focus and what we're doing.
Thank you, Ernest. Thank you, Carla. My next question is, how did you get started on this path to want to make a difference? So we're going to go with Ernest this time first.
Okay. For me, I got started. I used to read to kids. I worked in an insurance company, so I used to go read to kids in schools and read to kids at different places. Then I started working at a place called The Bridge, and it was a facility for youth. And it got to the point where I really enjoyed that more so than the actual job. It got to the point where they were coming to me and talking to me and asking questions. And then it became more of, it was more fulfilling for both. So I went from there and that experience to really looking into it, because I've always felt like things that I have to feel a reward, a sense of reward in things that I do. It's not just a job. And this is not just a job, it's more of a purpose and a calling to me. So as I got into it, I got more involved and it became kind of natural for me.
Thank you, Ernest. Carla.
Well, I always like to say Krispy Kreme donuts got me into the field. And let me explain why. When I was in junior high school, my junior high school counselor, Mr. Palmer Martin, I was a helper in the counseling office, and I used to see him and see how the kids would come, and they would have problems, and he'd talk to them. But I wanted to work in the office because he always bought Krispy Kreme donuts, so that was the only reason I wanted to be there. And the more I was there, and I was like, oh my goodness, I see kids come in crying, and he'd go, come in, sit down, and he would talk to them, and just seeing the change, just for them to be able to have someone and come to talk to and feel better and leave and get a donut. I was like, I want to do that. I said, that's the job for me. And literally from that point, I think I generally kind of, my friends and everyone always kind of told me I always had a helping kind of personality. People often just felt compelled to come to me and talk about things. And I had this desire to be able to help people and be able to offer tools so that people can help themselves. And fell in love with the field, and I've been in the field since 1988.
Very cool. One of the things that I heard both of you say, you didn't use these words, but it definitely comes over, is that you were both listeners. You were both listeners. And so that is important for all of us to be thinking about. I'll just share this little quick story. When I was a very young man, I had an opportunity on a job to interact with a coworker, and the coworker said, everybody would always greet each other and say, good morning, hello, how you doing? And he said, a lot of times this is really meaningless. And I said, why do you say that? He said, because a lot of times people are saying good morning, hello, but they're not even waiting to hear the answer. They're just doing it out of formality. And that stuck with me, that it's important when people are addressing you or talking to you, that you listen and wait. If they decide to tell you how they're feeling, they are risking something by doing that. And the least thing that you can do is listen to what they're saying. So wait for the answer. So my next question is, has there been any technology breakthroughs that have helped with mental health? And we're going to start with Carla on that one.
It's technology. The breakthroughs really has been being able to use telehealth to reach clients. And it really has soared, of course, during COVID, and where everything had to kind of flip over. So people who normally would not have accessed therapy have been able to access therapy. And the beauty of this is that you're able to reach, people are able to access therapists who are in areas or towns that may not have a therapist. And so being able to find platforms that offer the confidentiality and that reach the HIPAA qualifications, that has opened up a new, just a way for us to deliver therapy in terms of technology, of chat rooms for support groups as well, and groups. So this technology has entered into the mental health field arena, and for the good. I think there has been some hesitance about it, but I think COVID kind of thrusted us right on into it. There was a momentum before then, and but still, you know, folk kind of want to be able to sit down and sit in front of a live therapist and be able to sit down, see, you know, face to face body languages and stuff. And so that it was a myth before that it would be hard to convey, you know, empathy and positive regard through telehealth. But we are seeing that, and it's more and more that people find it comforting to be able to, I can do my session from my own home, or I can do my session at any time that I need to do it. We have also moved toward teletherapy within the city of Atlanta, and that makes it even easier for employees to be able to have access without having to leave work or leave their space or find a place. So we've been able to increase and touch more people by using telehealth and teletherapy. And so in that way, that's how technology has really bridge that gap, as well as along with the movement of removing the stigmas of seeking mental health.
Fantastic. Ernest.
And I'm going to ask Ernest to add some there too with that.
Okay.
Yeah, sure. Because definitely telehealth has been huge in two things, because telehealth came at a crucial point with COVID, the pandemic, and people were being at home and people were suffering. There were a lot of people suffered during the pandemic. And if they maintained a job, if they had EAP, then they could get help through the EAP programs, and then they can get telehealth, get teletherapy, telehealth. That's been great. And I think the multiple platforms that have been increased, because everybody started using certain platforms, but because as we talk about being HIPAA compliant, your electronic health records need to be safe. They need to be secure. So there have been a lot of advancements in technology in terms of EHR, EMRs, medical records, and platforms that actually are secure for you to provide that service and make sure that it's safe and there's no breaches. But then we talk about social media, because of the input and because of how large social media is, it covers a lot of ground, and people start talking about mental health in a different arena. They start talking about it more, not just people that you normally wouldn't hear talk about mental health. And then when they say, like the tennis player says, like she couldn't perform, or Simone Biles talk about her depression, then they get on social media and people talk about it. Then it becomes more recognized in the local communities, and everybody recognizes that we all suffer. We all have the possibility of handling this in a different way. So it allows people to be more open to get help. And you still have certain people that's not going to be that's not so open yet. They recognize they need it, but they still aren't ready, you know. So I think technology has afforded us a lot of opportunities. It's afforded us the opportunity for people to be open and honest about what they're feeling and what's going on, and then seek the help that they need, you know. We ran through a lot of stuff in over the last 18, 19 months, you know, so it's been anxiety producing and fear invoking just dealing with COVID alone, because you don't know where it's coming from. So, you know, I think everything happened within that same sequence, and it just kind of expanded, and it's not going to go backwards. Yeah.
Thank you. Thank you, Ernest. Thank you, Carla. So we're going to have a few questions from the attendees and those who are watching and listening. So Rupert, what's our first question?
We have a question from Tolak Lopez Waterman in Astoria, New York. What is the best way for each of us to deal with everyday moments of stress and disappointment? Is there a good practice for staying on an even keel?
Good question.
Very good question. I think that's an excellent question, being that this month, the month of September, is Self-Care Awareness Month. And when we have good self-care, that's a good way to help maintain our emotional wellness. And so a good self-care routine can be in making sure that you are getting enough sleep, making sure that you try to find balance in your life, that you have outlets that are healthy outlets, healthy social outlets, that you use mindfulness. And people hear about mindfulness and they go, well, what is mindfulness? And mindfulness can be used just in a matter of sitting at your desk or going for a walk and blocking out all of the thoughts in your head and paying attention to the trees and regrounding yourself. So being able to be aware of your stress and your stressors, and finding ways to build in stress relievers throughout the day and throughout your week, just making that a part of your daily routines, making sure that you get a good sleep. Oftentimes emotional wellness is challenged by the fact that we're suffering from sleep deprivation. We're not resting, or we're taking everything to bed with us. So basically, self-care is a good way to maintain good mental health and emotional wellness. So building in that time to have for yourself, that downtime, that quiet time, making sure that you're fueling your body and you're eating healthy, that you have a good support system of people that you can be around and that are positive and that can hear you and can talk to you. Journaling, being able to journal and write down your thoughts for the day. These are self-care kind of techniques that help you maintain good emotional health, mental health. And Ernest, or anyone else, did I leave anything out?
No, you don't leave anything out. Everybody has to be intentional. You have to prioritize you at some point in the day or the week.
Ernest, say that again.
You have to prioritize you at some point during the day or the week. I encourage my clients to at least take 30 minutes, like between work and home, just to kind of relax and unwind, like do something for you. I ask a couple questions. What is your hobby? Because typically adults don't really have hobbies anymore. Like, because they focus on the kids, taking them to school, taking them to practice, cooking them, making sure they eat. So everything else is about other people. So what is your hobby? Like, what do you do when you just want to unplug? Personally, I swim. So if I'm stressed out, if I can get to a pool in 30 minutes to an hour and I can swim, then I can unwind for myself. I try to at least do something every week for me. It may not happen, but I try to do something every week for myself. If it's just go for a walk, ride my bike, or do something, or just breathe. You can sit and just do guided imagery. So as Ms. Carla said, like, just go to the park or go sit at the lake and just watch the trees, like listen to the birds. 30 minutes is not a long time, but how often are we intentional in giving ourselves that break and giving ourselves those 30 minutes to just unwind and just, and journaling is excellent. Like, 'cause that's something you can do at the end of the day. Like before you go to bed, like sit on the bed, journal, write down your thoughts, whatever's stressing you out for that day, and write it down, get it out of your mind, get it out of your body. And then you also it's a chronicle of your own history. So you can go back and read it, over time. And then like, man, I remember that day I was pretty stressed out, but I made it through. So those are things in terms of self-care tips that you can use. Anybody can use.
Very cool. One of the things that I wanted to lift up that both of you kind of talked about too is, Ernest, you mentioned swimming, but I also think it's important for us to think in terms of deep breathing, taking time out just to take a breath and be intentional, as you said, Ernest, in terms of, making sure that we're getting our walk in, or if we're doing even low impact exercise, Those things are very, very important in terms of helping us deal with the daily mental strains that we have to deal with from time to time. So I just wanted to lift those up.
And let me say one thing, Tony, also, and I don't mean to cut you off, but
no, that's fine.
Because everybody was in the house so much last year, vitamin D deficiency is huge because it can show up in different ways, like your lack of energy, lack of rest, because you're not getting enough sun. So being deficient in vitamin D shows up physically in your body as well. And you may not even realize it, but it can lead to feelings of depression, sadness, and low energy, fatigue. So those are just some things that you kind of need to recognize and maybe get a vitamin D supplement just to kind of increase if you're not going outside and getting as much activity as you used to have.
Thank you. Thank you, Ernest, for sharing that. Rupert, do we have another question?
We do, from Chris Clark in Tempe, Arizona. In higher education, and especially in graduate education, I have noticed that many students and faculty members are dealing with stress. Do you have any advice for ways to establishing a lower stress working and learning environment?
Carla, I'm sorry.
Okay. All right. Yes. There's so yet again in terms of with especially students that are in graduate education programs, and in light of how learning has been for the past almost 2 years now, that has added stress to something that's already very stressful. You leave you sometimes traumatized from graduate programs, but yet again, it's still in terms of what academia can do in terms of education programs is, one, checking the thermometer. Sometimes we have to check that pulse check of what's going on in people's lives and the students that are coming in. And now what we realize is that your normal graduate student is not a student that is just coming out of undergrad. You may have a graduate student who's been out for several years, or a graduate student who is coming out, and being mindful of the pressures that these individuals are working jobs, are having families, and trying to make sure that they are making their classes, completing their assignments. So it is important for graduate programs to have probably their counseling departments to be aware of. Most universities and colleges have counseling departments that students should be connected to help them with ensuring that they have a self-care plan, that they're not overextending themselves. And when they are, they have someone that they're able to go to and be able to talk about it. Ensuring that they have advisors who they're able to speak with and say, okay, I'm overwhelmed, or I'm over my head, or, I've got this class, this, internship this semester going on, and then maybe I have a sick family member that I'm taking care of, and be able to assist with new ways of getting work done, and maybe leaning a little way sometimes from the traditional modes of completing assignments. And a lot of universities have taken on that. And where a lot of assignments, there's still a lot of remote learning, or learning via telelearning, and that students have the access to their advisors, to their instructors, to assignments, that they can do assignments that fit more into the mode of their life in real life. So I think it's important for graduate students to be able to look at where they are, what that sacrifice is going to be, and emotionally where they are. A lot of times we get so excited and, excited about, I'm in my program and I'm coming in to get my degree and save the world, and I'm going to do it all, and then when they get in there and they're drowning, and it's like, wait a minute, this is way more than I thought it was. And then they go, yeah, now I'm traumatized, And so I think putting advisors that are truly there. So often there are college programs where you don't have advisors and the program administrators are not in touch with the students and monitoring the students. And this is where we see an increase of suicides, maybe, or increased depression, or, as Ernest said, the prolonged persistence of the mental and emotional stress thus triggers a mental illness. And so when universities are proactive in ensuring that, hey, no, you may not need to take that heavy of a load this year because these are the personal parameters that you are dealing with right now. So I think when they take on that approach in terms of what universities can do in terms of just keeping the pulse on that these are humans and real life is happening even while they're in the middle of doing a thesis, and collecting data. So that would be my advice.
Thank you. Ernest, before you talk, I'm going to throw a little wrinkle in it. Yesterday, I happened to be watching TikTok, and there was a very young teacher who I would say probably has been a teacher for maybe 5 years or less. And she was saying that it wasn't any one particular thing. It was a combination of COVID and just the stresses of being in the classroom that she decided she started the school year thinking that she was going to finish out the year. But she said she had had enough. So I'm going to ask you to speak to possibly, some of the things that she might have been dealing with that didn't allow her to even make it to the winter break, So what do you think about that particular situation?
I think teachers are facing things in this COVID or post-COVID that they never had to face before. Over 75% of the kids that were doing virtual school struggled to pass classes. So they're behind even now. Then you're trying to get teachers to it depends on the school system. Some of them are trying to do virtual school as well as in-class learning all at the same time. There's a stress with their own personal health because they may not mandate that the kids wear masks. So they have their own anxiety and their fear for their own safety sometimes in just going to work. Then it gets to the point where you're questioning, like her, do I want to continue this career or is it just becoming too much for me? Because when you sign up to become a teacher, you didn't think about health risk or am I putting myself in jeopardy of catching and having a disease or something that could be fatal or could be deadly? So that changes the parameters of your job. So it can be quite stressful. Then you don't know, depending on the administration and the superintendent, like how they're reporting the numbers. Are the numbers accurate? So there's a lot of different stressors that's going in the teacher's mindset and their psyche now that they never had to worry about 3 years ago. I'm going to even say 10 years ago, just 3 years ago, just 2 years ago, they didn't have to worry about these things. Now that's an everyday worry. That's an everyday concern. Like, am I taking something to my house that could be deathly for my family? If I have kids, like, am I going to get my kids sick? Do I even want my kids to go to school? Because 90% of the kids in the school system are wearing masks, but they're not taking the vaccine. Some of the little kids can't even get the vaccine. So there are a lot of different parameters, man, that's causing a lot of stress. And teachers have to take those things into consideration and their health and their personal safety. They may not even feel like the governing body is taking their health into consideration because they have to go to school and they have to get these numbers. That's how they survive. And it's the state. So there are a lot of different things that make them stressful and make teaching maybe not the same exact fun job that they perceived or that they were their goal. Whatever their goal was when they went into teaching, it's different now. So that's a real question. Like, do I want to continue this? Is it safe? And Chris, for you being in education, like, do you have colleagues? Do you hear things from current teachers? Like,
absolutely. It's a very tough time, as you've said. Teaching is always a tough profession and an exhausting profession, and it's got a reputation. It used to have a reputation of being an easy job because the hours seemed short. The school day was only 6 hours long, and the summers tended to be perceived as vacation. But being a teacher myself and having teachers in the family at various levels, of course, you realize that teaching is actually a 24-hour day job. Teachers are always thinking about and planning for and recovering from what's going to happen tomorrow or what happened yesterday, and dealing with many other administrative burdens and challenges too. And now with the pandemic and all of the issues that Ernest pointed to with regard to their own safety and also members of their family, they may be, as we do, we live in a 3-generation household. So us grandparents are more vulnerable to infection and to things going poorly than would be the case if it were just a nuclear family with our daughter and her 2 kids. So all of these things are quite complicated and stressful and uncertain. That's the other source of anxiety, I think, among educators and among parents too. That is, the rules change, or when the numbers change, then we're going to go to all virtual for 2 weeks, or maybe for the whole semester, or maybe not. And having that kind of whiplash with working parents, unable to confidently plan on how their children are going to be taken care of during the day if they need to go to work themselves. In a way, the uncertainty is even more burdensome than an unsatisfactory situation that you believe is going to continue for the whole semester or the whole year. So the moving back and forth, the whiplash that people get is an extra level of stress. And the hope, of course, is that with greater vaccine coverage and with the passage of time, some of this uncertainty will be lessened and the amount of spread will be mitigated. But it's still a hope right now. It's not a guarantee. And of course, we're connected to the rest of the world. So even though we can be happy or disappointed with the rates of infection in our county or in our locality, the rest of the world is much less vaccinated and much less able to protect themselves than the people in the US. Even in states with the lowest rates of vaccination are far better off than many countries in the world who can't afford to have the kind of vaccination rollout that we have had in the US. So it's a very, very challenging time for everyone, and we get to see the spotlight on schools because that's a place where people of many different ages come together, and they're connected to people of even wider age ranges than the teachers and the students themselves. So stress is an understatement, and yet our teachers are some of the most idealistic people I've ever met. They're comparable in my mind to the frontline healthcare workers who are doing even more challenging work, more immediately threatening work to their own health and to that of their family members. And I happened to spend many hours this week in a hospital locally because a member of my family is hospitalized there. And I was so impressed with the morale of the doctors and the nurses, and also with a program that this particular hospital has, which is, I see posters all over the place saying, let's make this a peaceful environment. That's the theme, and it may be something that's national and common in other hospitals and groups of hospitals, but apparently, at least this hospital has made this a very high priority for all of their employees and for the visitors and the patients. That what can we do to keep this a peaceful environment? And there are 4 or 5 steps or foci of peacefulness that are suggested on these posters, and they're just inspiring. And apparently, from what I can see from 3 or 4 days of visiting, the nurses and the doctors and the aides are taking this very seriously. I've never been asked as many times, how are you doing? Is there anything I can do for you? Because of course, we realize that when you're being treated for a medical condition, that's not an all-day thing. You get doses of medicine or you have a test, but then there's a lot of downtime. And what I think they're trying to do is fill that time between medical treatment with peace, with support, with
Dr. Clark, let me just push back a little bit, because I really want to sort of talk more about this stress that the educators are actually having in the classroom. I think that it is a bigger problem. Well, we have, let me just say that I participate in a group that has very serious conversations on Saturday about education. And some of the things, well, let me do this. I'm going to invite you to participate in the education hour that we have in office hours every Saturday. It is not broadcasted on YouTube, and educators are there, and they're free to have meaningful conversations that they need to have with each other. And these are people who are all over the country and all over the world, who are influencers, who are educators, who are in administration, and they have, they're talking about the things that they're actually grappling with. And I think on a level that educators, as you have already said, Dr. Clark, in that they are dealing with a lot of stressors prior to COVID. Then you add COVID in. One of the things that I did when I first graduated from college is I worked as a supply teacher. In some places it's called substitute teacher, some places it's called supply teacher. And so I worked in the city of Atlanta in a very inner city school that was connected to a housing community that we sometimes call projects. And one of the things that I dealt with back then, and we're talking about more than 35 years ago, was that we had to provide the students, we didn't have to, but we chose to provide the students with toiletries to help them clean themselves up so that they didn't get teased by their classmates for maybe not having the best odor. We provided them with toothbrush and toothpaste and lotion and equipment, notebooks and pens and pencils, and it was a thing where it was understood that that is what was needed in order to help the students. I only bring it up because if you think about, there are some situations in 2021 where those same kinds of things, believe it or not, are still going on. And because those things are still going on, those types of experiences are still going on for some students. Then you add in all of this COVID pressure. So when you add all of that in with what's already a difficult job, spending, countless money out of your pocket that you were not being reimbursed for, it stands to reason that, and it stands to reason that teachers can say, I've had enough. I've had enough. So I didn't really mean to get off into that, but it was just, it was on my heart from the standpoint that I think sometimes there is a minimizing of what good teachers do. And I think it's important for us to lift up the fact that they are under tremendous pressure to, I'm trying to say this in a very tactful way, show numbers. And sometimes they're being pushed not to, well, I'm retired and I can say a lot of things. So,
Tony, I just want to say one thing, just like in mentioning that, like there's a large population of kids, like their main meal comes from school on a daily basis. Like even in COVID, like they had in certain areas, they had to go out and do food drives to make sure that these kids eat, because they know without school, they're not eating properly, And then let's talk about mental health. How does that play into the kids' mental health? Like, are they capable of doing that work? Are they successful in school? Can they study? So, I mean, there are a lot of things that go into teaching in the teaching industry that are unspoken, uncongratulatory things that they do just as part of their job, and it can be quite stressful, and that's the thing that, especially for a young teacher. You say she's been teaching 5 years, so that's a young teacher. She's just getting into her career. And they just came out of school. She's made all the sacrifice to get her degree to get into this career. So 5 years down the line, she's like, this is not necessarily what I was thinking about. This is not what I signed up for. So then for me and Ms. Hawkins, then we talk about an adjustment to life. What do we do now? And then come to, that's when you may want to go to a therapist or get some help, because it may have you feeling inadequate. It may have you feeling hopeless. Like, what do I do now? Like, you may have student loans. So now you got hundreds of thousands of student loan debt, and you don't even want to do this job anymore. So that's stressful. It's overwhelming,
I would like to chime in there, Tony, and add a little bit more what you're talking about in terms of, I was raised by an educator, a family of educators. A majority of my friends now are educators, and I saw them being concerned about their students, and it was still stressful. Even though they're telelearning, they're worried because they're not coming in every day. They're not seeing them every day. And so back to your question regarding why this teacher, it was just too much stress. Because if you think about it, you bring it in and you got your own stuff. And then you are a teacher, and these are your children, your babies. They're yours. Because when you get that class, they're yours. Is that not right, Dr. Clark? They're yours. And so you're concerned about everything, every aspect, because they're going to come to you and tell you things sometimes they're not going to tell their parents. And then when you think we're in the middle of, and especially the past 2 years, we had to deal with a pandemic, social unrest, you know? And so you're like, whoa, how are we supposed to cope with this? And still teachers are dealing with, they're not able to see their students. Then there are certain constraints there that they have to deal with, as well as they have to meet numbers. You know, I'm like you, I'm not in the school system anymore, so I can say what I want to say. They're being pushed to drive numbers and testing when you're saying, how, you know, has this child has been out, we've been remote learning. And a lot of the children in certain economic levels might not have had the internet access. So making means, I know of teachers and educators that are friends of mine that drove around taking laptops to homes to ensure, and taking Wi-Fi sticks to ensure. They're driving around on a Sunday night. That's not what we do. You know, but this is what teachers are doing. So then when you say the stress and you think about that they're dealing with that because they're taking ownage of this the education of this child. And I think it is such a, you know, thing that people don't take into consideration when you say, well, why are teachers so stressed out, or why are they saying, you know, we need to, you know, we need masks, we need vaccines. They want their kids back in the school, you know. But they are also dealing with their own issues. They're dealing with teachers that have died. They're dealing with the fact that there have been 3 deaths that they hadn't had a chance to rebound from the first. They're still in the middle of the grieving process of the first death. And maybe they have lost loved ones. So we're dealing with grief. And it's getting complicated, y'all. It's getting complicated because it's constantly happening. You don't have time to say I've adjusted to this, because there's no adjustment period. And this is where we are right now. And so not only in the teaching profession, we're seeing people throwing hats in all professions across the board. You know, where people are looking at life and reevaluating and saying, as Dr. Clark mentioned at the hospital, that peace, wanting to find peace. And so we're seeing these changes that companies and businesses are having to look at, because how are we going to work now? How are we going to, you know, have employees come in? Because people are really understanding the importance of their emotional well-being. And it has been tested. It has been tested across the board, and it's still being tested.
I want to thank you all for your comments on that particular question. We're going to move a little quickly on the remaining questions because we're getting close to that time. I know that we can have this conversation for an extended period of time, but we are limited in terms of this particular conversation. So, Rupert, let's fire up another question.
Okay, from YouTube, Alina Johnson asks, my question is, what suggestion would you give to educators about dealing with their own mental health issues?
I'll take that question from Miss Arlena Johnson of Maynard Jackson High School, City of Atlanta, who pretty much goes to that school every day with an S on her chest. But I suggest that the self-care, teachers, you have to take care of yourselves. And I think that there is this sometimes that they put their students, their families, before themselves, because it takes a special person to go in that classroom and go into that school and go into that building every day and know that, you know, there's some kid that's going to need you. There's something you go there to say, I'm going to teach from this lesson plan. And you know that there's a whole lot of other things that go on there that you know you're needed. And so in order for you to take care of others, you have to take care of yourselves. I suggest that educators make use of your EAP programs. I suggest anyone in any job, make use of your EAP programs to have someone to go and talk to process. Sometimes it's just good to go and sit and let some non-judgmental individual let you get it all out and give you some tools and healthy tools. As we mentioned earlier, a lot of the self-care tools, ensuring that you've got a hobby, ensuring that you're doing something one day that's just for you and not just for everybody, but kind of making it seem like it's for, you, but you're doing it for other people. Because that's what educators and helping relation people do, and people who, take care of others, caregivers. Being able to make sure that you do your self-care. And when don't hesitate. Don't sit back and say, I got this. I'm supposed to be a superwoman or superman and deal with this. Everyone needs to be able to feel comfortable with getting help. And so it's just kind of been a thing that I think, my colleagues, friends, everyone, in terms of hearing me say over and over again, normalizing seeking mental health. Millennials, they're on it. They want a therapist, and so you need to follow that lead. Want a therapist. Be able to have someone that you can go to who is going to be objective, is going to be able to tell you what you need to hear, not what you want to hear. Or you're able to just release. Learn the art of journaling. Learn to take care of yourself and take time out. I always tell folk, when life just gets at you and stress is on you and stress is standing in your face, is standing to the right of you, standing to the left of you, do what gives you life. Stop and breathe. Just breathe. Because breath, that's what gives you life. And then you push the restart button. And then you say, I got this. And I got this may mean I'm going to call EAP and get some help. I'm going to reach out to someone and talk to me. I'm going to take a mindfulness walk. I'm going to learn mindfulness. I'm going to learn to stay in the here and now and not time travel, worrying about what happened in the past and worrying about what's going to happen, and stay right here and deal with what's in front of me right now, and learning to self-regulate our emotions. And so that's my suggestion, not only for educators, but for anyone. Also, finding a support group, especially of some like-minded people who may be in the same profession sometimes. That may be good for you. Sometimes your friends may not do the same job that you do, but find that connection of people who can understand and they know your drama. They know what's going on. And so being able to, one, connect, take care of yourself, getting enough rest, taking care of yourself medically, not letting things go, blood pressure and all those kinds of things go. And just checking in with yourself every day, doing that feeling check in and say, what am I feeling? And if you wake up and that's a bad feeling, then guess who has the power to decide, I'm not going to do that today? You do. And
Thank
so
you, Carla.
those are my suggestions.
Thank you. Thank you. Ernest, I'll give you opportunity to add to that if you'd like.
No, I agree 100% with what she said. Go get help. You got EAP, you have therapists, you have all cultural levels of therapy. You got African Americans, Hispanic.
And for someone who doesn't know, what is EAP?
EAP is Employee Assistance Programs. Most EAP programs will give you at least 5 to 10 sessions that comes with your benefit package as an employee. So if you call your EAP plan, let them know that you're having some mental health crisis and you need some behavioral health services, they'll let you know exactly how many EAP sessions you can have. So if you want to utilize that before you actually try to find your own personal therapist, that's a great way to get services and test therapy and to make sure that it's comfortable for you. We just have to be intentional in prioritizing our mental health. Like, I personally feel like you need a therapist for your mental health, just like you need a doctor for your physical health. At least every 6 months, man, go to your therapist and check in, man. Like, talk about your stress, what's going on, and your feelings, and leave it there and kind of, unplug and restart. I'm totally in agreement with everything that Carla said. There's just so many stigmas in certain communities is about getting therapy. So and it's really you making a decision to not get help. At the end of the day, you're deciding not to go get help, and you know you need help. So if you recognize you're having some symptoms, and you feel something, and you know when you're not feeling your best, just go get help.
Thank you, Carla and Ernest, for that. I'm going to go back to something I said earlier. What does it really come down to? Listening to what someone is saying. I'm just going to go to the next question after that. Rupert, what's the next question?
We have from Verisa Hendricks via YouTube. What can parents do to promote the mental well-being of their children?
Carla.
I think the one thing that parents can do is, one, what Tony just finished saying, one, listening and making a place that's safe for children to come to you, or if not you, someone that is trusted, to be able to talk about their feelings. One, work with your children and talk about feelings. Teaching them, one, how to label their feelings, not just, well, how you feeling? Ask, well, if you're feeling like that, tell me about that. Label it, look at it, process it, and help them be able to verbalize and put it into context what they're feeling. Because for children, sometimes they just don't have the vocabulary to be able. So then when you're able to just continuously have conversations with them about the importance of emotional wellness, the number one thing you can do is maintain your emotional wellness, because kids are watching you. They're watching how you handle stress. They're watching how you deal with your depression. They're watching how you handle, managing your life and taking care of yourself. They're watching. So if you make it important to say that what their words, their feelings matter, then you're going to know what your children need, and they're going to come to you and say what they need. So the main thing is making it clear that it's okay to say, I'm not feeling good. I know I used to, and my daughter, if she's on, would say, I'd always go, so what you feeling today? And she'd go, regular. And then I say, she'd go, I'm just saying that so you quit asking me what you feel, But some days she wouldn't say I'm regular or I'm upset. She would have a lot to say, and that would open the door. So what you feeling today? Or if they're telling you about certain things, asking them, how do you feel about that? And then help them with the words of being able to talk about what they feel. So it's just making it where your child, having that relationship where your child feel comfortable talking to you and talking to your child. I think so often parents get in the car and they're on the cell phone and they're texting and they're doing, and it's, hey, how you doing? And not listening to children when they're telling us, I'm having a problem. And a lot of times when you go, well, what happened today? Nothing. Well, you need to kind of not ask that question of what happened today. Ask what interesting happened, or what's the thing that frustrated you today, or what's the thing that made you really feel good about today. Then you get more dialogue. Then your child knows then, yeah, you really do want to know, you really do want to hear what I'm saying. Or if I don't know how to say it, help me say it. But yet again, just making it normal, that, mental health and self-care, and just normalizing it.
Let me say this, children are a little different. Children and teenagers especially. I've been working with kids for 20 years. So there's a significant group of kids that they're not gonna tell you. They're gonna go in their room. Their phone is everything to them. Everything, their whole life is their phone. And they go in their room with their phone and their computer, play video games, and not talk to their parents at all. You have to find a way to connect with your kid. And you have to find a way to definitely listen to what they're saying. One thing about parents, and I'm a parent myself, we kind of get busy parenting and telling them what to do all the time, in opposed to trying to hear them, okay? So sometimes, even if they say, I don't want to talk today, Okay, well, you're going to talk tomorrow. Make a plan. Tomorrow we're going to sit down. We're going to go do something. We're going to get something to eat. And I need to know what's going on with you, and give them an opportunity. Just give them 100 undivided attention and allow them to talk to you and give them that space so they can share. Like I said, I worked in hospitals for years. And one of the biggest things that I saw with kids that were suicidal or depressed is that nobody listened to them. Their parents weren't listening. They had their own struggle. They may have gone through divorce. They may have just been working, trying to pay bills. And the kid was really at home, kind of raising themselves and taking care of themselves. And nobody was really listening to them. And they were doing all kind of other things and hiding things from their parents because they had access to do things. So
I really want to get into this, but the questions are piling up, and it's really serious. The things that our young people are dealing with, but we want to try to get into some more of the questions. So thank you so much. Thank you, Carla and Ernest, for your comments on that question. So the next question, Rupert, is what?
Question from Twilight Lopez Waterman in Astoria, New York. We all deal with our own mental well-being, but also we have friends, family, and loved ones around us that are dealing with their own as well. How can we be there for them?
Carla?
Okay. With that question, when it's mental health, touches most of our families, and we all know someone dealing with some form of a mental health issue. And the main thing is to be supportive, encourage them in taking care of their mental illness, and being able to make it a safe place for them to talk about whatever they're dealing with and their symptoms and their needs, as well as encouraging them to seek support and to stick with their support. So many individuals with severe mental illnesses sometimes don't stick with their treatments, and families struggle with that. I also urge families to reach out for support from NAMI organizations, because there are other support groups that can help families who are dealing with the same thing or dealing with a family member that is dealing with a severe mental illness, and give ideas and give that support, because sometimes families can feel isolated sometimes. That they're dealing with this, and yet again, in many cultures, there's still a lot of stigma centered around mental illnesses. So, you used to be, you didn't really talk about it, or you didn't say anything about it, or you tried to pretend, or you made excuses for it. But as I said, the layers are coming back, and the stigmas are kind of moving away from it. And it's just one, to go to a support group, find support groups of family members who are dealing with a mental illness. It can give you ideas and maybe not make the family feel so isolated, and how to support that individual. But mainly being open and honest with that individual, encouraging them to, take care of themselves and their mental health. Ensuring that they are, encouraging them to get professional help and to stick with that professional help. Making an environment that, they're not some anomaly or something that's wrong with them, that they are part of the family, and that the family, is there. It's a family thing, because it does affect the whole family. A person with an illness, it affects the family. And so a family can work together to encourage that individual to continue to stay as mentally and emotionally well as they can.
Thank you, Carla. Rupert, we're going to go to the next question.
Actually,
and we're going to let Ernest answer the next question.
That was the last question in the queue.
That was the last question in the queue.
Yes, sir.
Wow. Well, Ernest, you want to add to that last question?
No, she did a great job with that. Just giving the support. Like you said, NAMI has a lot of different education. And if you don't know NAMI is the National Association of Mental Illness. And so it's NAMI.org. And they have a long listing of support groups, educational programs. educate yourselves. Like if you don't know where to get help, if you don't know exactly what to do, get education. Look it up on the internet. Like you can Google anything nowadays, you know. But NAMI has a large support system across the U.S. and you can get a lot of services. So if you don't know or you're not familiar, as a group, support the family. Like we all going to go to this support group. We're all going to get educated today, you know. So that's giving them that support to get the help that they need. You know, at the end of the day, is seeking help and looking for the knowledge to get the help that you need.
Thank you so much. I have several questions, but I'm only going to ask one. And so my next question, and this question is really to everybody that wants to answer this question. So you're speaking to the world. What do you want them to know about mental health? What do you want the world to know about mental health?
I want the world to understand what we all deal with. No one, you know, as long as you're breathing and you're dealing with some kind of emotional experience, and the importance of being feeling it's a good emotional well-being is knowing that you have a space to be heard, understood. And as you said, the key thing there, Tony, is the listening. And so when people feel that they've been heard and understood, whether you got an answer for them or a solution to the problem or not, that's half the battle there, that you hear me and you understand me. And that does so much for the emotional well-being of people. And knowing that it's to normalize saying, I need some help, and asking for help and making a way, not, you know, so often people can be around people and they may have an issue and they haven't said anything. And someone says, oh, if you go to a therapist, you just whining and nothing's wrong. Be mindful of your words, because you don't know who is experiencing, who is 1 minute away from saying, I give up. You never know. So I want the word mental illness to be is normalized and not carry any stigma as much as any other word that we use. You know, hey, it's Krispy Kreme donuts. You know, I want it to be okay to say, I'm not feeling well right now, emotionally, mentally. I want people to be sensitive to that.
Ernest?
Well, piggybacking on what Carla said, there's a fine line going from positive mental health to negative mental health. You know, and we're conditioned to just keep pushing and keep pushing. We don't know what that limit is, you know, and one situation could really just push you over the edge if you're not practicing and you're not intentional about unplugging, being honest with yourself regarding your stress levels, your emotions, your temperaments. Then you need to really be cautious in terms of not seeking help. You know, like I said, it's a decision to not go get help. Sometimes it's pride, sometimes it is the stigma, sometimes it is what other people say. But at the end of the day, you definitely know how you feel. If you know you're depressed, you know you're having some feelings of sadness, you know you're having some lack of motivations, then you may want to get some help. You know, and don't be too proud to go get the help that you need. You know, I'm just a big advocate. Just go get help. You know, even at the end of the day, what does it hurt if you go talk to somebody, even if you feel like you didn't gain anything out of it, but at least you were able to unload the stressors, talk about what's going on, and then when you leave the room, when you leave the Zoom call, may it be, at least you feel a little less stressed because you got that off your chest. What does that hurt? Nothing.
Thank you, sir. Appreciate that.
Yeah.
Dr. Clark.
many years ago, I learned of a theory that was popular, and I think still is, in marriage counseling. And the idea was that when you act towards someone else, whether it's positively and generously or negatively and critically and contemptuously, you experience those emotions and those messages that you're sending to someone else as though they were being directed at you. So in other words, the conclusion of it is, if you act generously and patiently and supportively to others, even though that's not your motive to benefit yourself, you will benefit from it. So part of my mental health regimen isn't so much to be looking inward and trying to analyze myself, or have help from a professional perhaps to do that, but it's to say, well, I'm feeling a little down, but sometimes the best way to feel a little bit better is to do something positive for or towards someone else. And it certainly does the other person some good. And surprise, surprise, it helps me too. So that's what I have to say to the world is act like you wish to be acted upon, and pretty much it'll help. And it'll certainly help the person you're trying to be generous to. And you might be pleasantly surprised that it makes you feel better too. I think that's the secret of conversations with Tony Mobley, frankly.
Thank you for that, Dr. Clark. Rupert.
I would just say, I mean, we've had a lot of great insights this evening, and great discussion, and things can get complicated, but I think buried in there somewhere is also some simple things, about some of the basics: looking after yourself, getting your rest, eating properly, having your exercise, whatever those things are that are necessary to maintain yourself. And when things don't go right, or things may seem confusing, or in a challenging situation, I think it's important to sort of take stock of where you are in that moment. Try and think, well, have I had enough sleep? Did I have a good meal? Have I exercised? Have I done the things that would set me up for success? And if you haven't done those things, just try and remember that and focus on trying to do those things. And then the next step may just get a little better and a little better.
Thank you, Rupert. So we're going to have final words from Ernest and Carla. And I'm going to ask them, as they prepare to make their final comments, because these are practicing therapists, and they have I was going to say ministry. They have, well, it is a ministry, but they have practice. And so as they make their final statements, I want them to share, make their final comments, to share their practice information as well as their final words. So we're going to start with Ernest.
Yeah, Tony, I'd like to thank you for just having me on to talk about mental health and allow me to share my feelings, my plight. My company is Infinite Life Counseling. We focus on trauma. We focus on healing kids, healing families, healing individuals from the impact of trauma. You can find me online. It's iLife, ILIFE counseling.org. That's ilifecounseling.org. Or you can give me a call at 678-903-2156.
Please share that phone number one more time, please.
678-903-2156.
Thank you, sir.
You're welcome. Thank you.
Carla.
Well, I'd like to say thank you, Tony, for having me tonight. And thank you so much for addressing a topic that is just so paramount to us, and especially now and during this time and what we're dealing with between, pandemic and everything. Anytime that, you use a platform to talk about a subject such as this, that moves it one step closer to normalizing it. And also, you never know who you reached out to tonight, and someone that prompted that person that they're going to reach out. That is why I provided you with those resources that are flashing over the screen there, and the links for the various resources of the suicide prevention psychology today. You can go to and look up and find you a therapist if you've needed a therapist. The SAMHSA site will be able to give you treatment facilities from
and what is SAMHSA?
SAMHSA is the Substance Abuse and Mental Health Association for the federal government. And that is just like your one-stop to find locator for all mental health services there, and treatment locator. There are also some other resources that are available, therapist directories. There's some, Ernest mentioned earlier, social media, and you can find a lot of these resources on some of the Instagram sites I know there's the Therapy for Black Men and Therapy for the Black Girls. So they have Instagram sites that give out information on an ongoing basis, as well as links to information and resources. My practice is practical guidance and psychotherapy, and you can reach me at 678-576-3824. Again, that's practical guidance and psychotherapy, and my number is 678-576-3824. And again, I thank you, all of the panel members. This was I feel very privileged to have been here tonight and shared in this experience.
Well, thank you so much, Carla. And also, there's going to be other links that will be shared with the YouTube, that will be on the YouTube channel. So there will be additional links, and the links that have already been shared. And again, the practice information for both Ernest and Carla will be shared as well. And so I want to thank everyone so much for being here tonight. I want to thank my two guest panelists and my two office hour supporters who have ventured on this serious conversation with me tonight. So thank you both so much. And we are going to end the program with our thank yous. And so I'm going to apologize for my thank yous in advance, because I typically leave someone off. And so understand that if I left you off, it was not intentional. And I just want to say thank you for the community that supports me. Well, let me just read the list instead of, because I sort of get off tangent when I just start talking about how thankful I am for my supporters. So let me start with Kimberly Mobley. Thank you so much. The Global Family and Friends, Alex Lindsay and the Office Hour members, DVE Store, Liminal Entertainment and Technologies, Byte Hive, VDO 360, ApprovedForLoan.com, Talak Lopez Waterman, Mr. Ken Jordan, Aaron Huslich, Chirot Cheetah, Jonas Dattel, Marcus Lee Folk, Richard Lavery, Chris Fenwick, Manilo Lorenzna, Jeffrey Powers, Hasmuk Gugir. And so I want to say thank you all so much for your support, your encouragement with Conversations with Tony Mobley. And this is what we do. We have interesting conversation with interesting people. This is what we do. And so again, thank you for all your efforts towards healing, Carla and Ernest. Thank you so much. Next week's panel is going to be a panel of educators, and I'm not going to name all of them, but I'm just going to tell you that there's a lot of them, and they all have very unique and special skills. So I'm going to say something that's a little old-fashioned, but I'm going to say be there or be square, because it's going to be a very dynamic education conversation. And Dr. Clark is going to be there as well. And so coming soon, we're going to have, again, educators coming, filmmakers, musicians. Oh, the musicians that are coming. Oh boy, you want to tune in for that. We have interesting conversations with interesting people. Thank you all so much. And we're going to say good night. Again, panelists and guests, thank you so much for participating in Conversations with Tony Mobley. Thank you. Good night.